Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for this episode is quality of life improvement after scleral lens fitting in patients with keratoconus. And now I'd like to thank our host, Dr. Dave Kading, our topical expert, Dr. Lindsay Six, and our lead topical editor, Dr. Andrew Pucker. And now it's my pleasure to turn it over to Dr. Kading in the studio.
Thank you for joining us today. My name is Dr. David Kading. I practice in Seattle, Washington. And today we're joined by Dr. Lindsay Six, who is an associate professor at the Illinois College of Optometry. Today we're going to be talking with Dr. Six about an interesting paper here called The Quality of Life Improvements After Scleral Lens Fitting in Patients with Keratoconus. Dr. Six, thank you for joining us today. Can you tell us a little bit about what this paper is about and what it covers?
Yeah, thanks, Dave. It's great to be here talking about keratoconus with you. So with our keratoconus patients, we know we're always trying to find the best ways to care and manage their disease. And we specialize in contact lenses a lot of times, and that's the only vision correction that these patients can get their best vision. So we know a little bit from prior studies like that from the SCOPE group in 2018 and 2020 that through survey-based assessments of patients, that satisfaction with scleral lenses is higher than with GP lenses in the adult population. And so this paper really kind of took the opposite approach where they surveyed patients using a validated instrument, the NEI VFQ, and to see if there was functional improvement for these patients with visual gain that correlated to quality of life. So it kind of gets you thinking, like, are scleral lenses a last resort for us, or should we maybe be employing them more often in certain patient populations?
Interesting. So tell us a little bit about this functional improvement, this NEI VFQ. What's that all about?
Yeah, so the NEI VFQ is a quality of life measure that's specific for vision care, and it's used in a wide variety of studies. Now, it's not specific to keratoconus, but the authors chose the NEI VFQ because it is used in so many other studies, and you can kind of compare different disease states in terms of how the patients are affected in terms of their quality of life. So they use this instrument to look at patients with keratoconus and how their lives were affected by scleral lenses.
How were their lives affected by scleral lenses?
Yeah, so they found that there was more functional improvement, which they're calling visual gain, and that gain was greater in patients that had more advanced levels of keratoconus. So in patients with more advanced keratoconus, they had basically like more to gain in terms of visual function from wearing scleral lenses. The kind of corollary to that is they didn't find any association between NEI VFQ scores and the level of severity of keratoconus. So what that means is overall quality of life can be improved in basically any level of keratoconus, any level of severity with scleral lenses.
So historically, and I think this has shifted a little bit, but historically, we used to think scleral lenses were for last resort patients. Is that what this supports, or does this support any level of keratoconus? Because it kind of sounds like the more advanced received the best improvement, but what about the people who weren't as advanced?
Yeah, it's basically what you said, right? It's patients with more advanced disease have more to gain, but it certainly can be a procedure or an application that we can use for patients in all levels of keratoconus. And really the way that we can kind of add this to our armamentarium in terms of articles and papers that looked at scleral lenses and how they can help patients with irregular corneas and ocular surface disease, it's just like another kind of application for these patients, kind of showing that scleral lenses can be useful.
Awesome. So clinically, anything else about this particular publication that you think adds to us to make us better clinicians or think about scleral lenses in a new way?
Yeah, there were a couple of things that I found interesting that they pointed out in their discussion. One of the criteria that they used to kind of assess the severity of keratoconus was the CRUMAC definition. And that's a lot of times what we use for like insurances or to stage our keratoconus patients. And they kind of found that it was an outdated way to assess the severity of keratoconus. So that kind of, while insurance is like it, or it's very, widely used in the literature, it may not be the most reliable or applicable to the disease burden and severity that our patients are experiencing. And the other thing that they pointed out was that there was a 20% dropout rate. And I think, this is ultimately related to handling and discomfort. And so this is about on par with what we expected, I think, to see based on kind of other studies that are out there. So even though we know that scleral lenses have benefits over GP lenses from the SCOPE survey and other surveys, they're still at risk of dropout. And so we really need to follow up appropriately with these patients, make sure they're using the right solutions, make sure they're not having any handling challenges. And that can help keep them in scleral lenses long term as comfortably as possible.
Awesome. Well, fantastic paper. I think that it really speaks to the importance of scleral lenses in our keratoconus patients. I appreciate you contributing and sharing your perspectives on this. And thank you for joining us for this episode. We look forward to you joining us again next time.
And a special thanks to Cooper Vision for their educational grant to make it all happen.